Welcome back to our sixth lecture in PTCB examination preparation. Last time we were actually talking about anticoagulants. We talked about warfarin and others. Right now we're going to talk about antiplatelets. We're still in the cardiovascular drug classes. And so we'll go on from antiplatelets right now. So antiplatelets are medications that actually prevents platelets aggregation, and when platelets aggregate, they are part of they cause clotting. So part of the treatment of people who clot easily, or they have some kind of a history of stroke, or are prone to stroke or clots, we give them those medications, the antiplatelets, in order to prevent future clots or from clots from forming in their blood vessels, which can easily lead to strokes, can easily lead to STEMIs and other kind of cardiovascular effects that we are trying to avoid. So the indications for antiplatelets, there are, as we said, they're used for reduce the risk of recurrent myocardial infarction, stroke and angina. Their adverse reactions are the opposite of what they're using to treat. So that's actually a good hint to remember some of the very important side effects. Like, for example, a medication that's used to prevent clot, if it exceeds what it's supposed to do for any type of reason, whether it's in regards to dose or metabolic enzymes or anything else, it can cause actually bleeding, because you end up from preventing clotting to making the blood actually do not clot well enough for it to stop bleeding, so people can suffer from bleeding and bruises and all those stuff. They also can cause stomach irritations. We're going to talk about those medications, especially antiplatelets group. They are very well known as causing irritations and upset stomach. Some of those commonly used ones are aspirin, clopidogrel, prasuquel, and ticagrelor. So those medications are the basis where we can say that there is all of them can cause stomach irritations. They all should not be taken on an empty stomach, and they can really have some really adverse adverse effects on the GI tract. So they're not soft on the GI tract or the stomach, so they have some kind of limitations in that format. If people really have like active ulcers or PUDs or GERD, this can be actually a kind of an issue for them that should not be, those type of medications should not be prescribed for those individuals. So we talked very simply about it. Then we go into another type of medications. Those medications are called diuretics, and diuretics means they enhance the diuresis, which means they increase the urine production to alleviate edema-related hypertension. So if there is a volume overload, and usually that is accompanied by more salts. That's why we tell people who have hypertensive, you have to limit your intake of salt, because the more salt people retake, the more fluid it retains into our bodies. So if there is an increase in fluid or there is a more retention of fluids, we call it fluid overload. This can actually lead to more to worsening hypertension. So, or if there is an edema, usually edemas in the extremities, in the leg, in the foot, those are kind of signs. First thing we need to think about is either two things. Is it kind of a heart problem, because we should not have edema normally, and the other thing could be actually liver problems. So by reducing those overloads of extra fluid, whether it's related to edema or in the blood flow, we help reduce the blood sugar. We have to reduce the blood pressure. Commonly used diuretics are bumetanide, which is Bumix, furosemide, which is Lasix, hydrodiuracil, which is hydrochlorothiazide, spironolactone, which is aldactone, trimethylene, hydrochlorothiazide, which is the diazide. And we have to be very careful with those types of medications. Their side effects include orthostatic hypertension or even regular hypertension. And orthostatic means when someone tries to get up from a sitting or a lying down position, they kind of like they can lose. They feel like they're not stable. They feel like dizzy, and they can easily fall because of the sudden drop in blood pressure once someone changes his position or her position from a sitting or lying down into a standing or upright position. It also causes hypokalemia, and hypokalemia means lower potassium in the blood. And this happens because most of the diuretics, except one in that group that we have here, which is aldactone, they always cause the depletion of potassium. So potassium is accompanied by fluids, which they get by excess fluid that gets excreted by urine. So the more urine we make, the more potassium we actually excrete from our body. So the normal consequences of diuretics is hypokalemia, because water is attracted to potassium, and then once we get rid of those extra fluids in our body, that means we're also excreting or getting rid of potassium. Hypokalemia or hyperkalemia, whether the low level or high level of potassium, are really very dangerous. Potassium is required for the heart rhythm. So if the concentration in the blood increases or decreases, this can really cause arrhythmias, which we are trying also to avoid by all means. There are other types of medications too that belong to this group. There's also the vasodilators, which are included for angina, hypertension, congestive heart failure. There's also, those drugs cause also orthostatic hypertension. They can cause bradycardia, they can cause flushing. And if we want to understand, actually, there are two ways where we can reduce blood pressure. Mainly, I think we might have said that before, but the most important thing, if we can think about the heart as a pump, like a water pump, and our blood vessels as the hoses that are attached to the pump. So there are two factors that help, or actually two main factors for blood pressure. It is the force of the pump itself. So the more force it pumps, the more is the pressure of the water. And we will compare it to our heart, which pumps blood into the veins, into the arteries, in the cardiovascular system. And also the other factor is the resistance of those blood vessels. So if we have more powerful pumping from the heart, then this can lead to high blood pressure. And also, more resistance means, then if you can think about it, when water flows from a pump in a wide hose, the water will come out like pouring. But if we have a very narrow hose, or narrow hoses in general, you can find the water coming up in a very high force. That's if we have, that's keeping fixed the power of the pump. So if we maintained the same power of a pump, and then we attach the pump to the same pump, we attach it to kind of a wide lumen hose, a wide hose, and the water will be pouring out slowly. But if we connect a narrow hose to the same exact pump with the same exact force, water will come out from the open end so with a great force. So that can tell us this is what meant by resistance. So if we are able, so the way we can control blood pressure is basically if we are able to reduce the forcible contractions of the heart or control it. The other way is actually increasing the, causing vasodilation, and that's increased the lumen of those blood vessels. So the resistance is less, as if we are actually changing the narrow lumen hoses with wide lumen hoses. So anything that causes vasodilation, dilating of the veins and arteries, that will lead to reduction in blood pressure. And this is how vasodilators work. So vasodilators, they cause, from their name, they cause dilation of the blood vessels, and this dilation of blood vessels causes reduction in blood pressure. Commonly used vasodilators are isosorbide dinitrate, which is dinitrate SR, isosorbide mononitrate, which is MDOR, hydralazine, which is piperacillin, and nitroprusside, which is nitropres, and nitroglycerin, which is nitrostat. So anything that has nitro in it is basically, or nitro or nitrate, is basically a vasodilator. And the other exception is hydralazine, because it doesn't have nitro, but it's still a vasodilator too. After that, we can go into another type of medications, which are the beta blockers. And beta blockers are medications that are used to treat hypertension, and they're also used to treat angina. We're still under the hypertensive blood pressure medications, and they work by blocking the beta blockers, the beta receptors. So the beta receptors in the heart, when they get activated, they cause forcible pumping or extra pumping and pressure from the heart. So if we are able to block those beta receptors, that means we are not activating the heart muscles to pump more forcibly and strongly, and that's how actually the blood pressure gets lowered. Some of those common beta blockers are atenolol, which is tenormin, bisoprolol, which is Zbeta, metoprolol succinate, metoprolol tartrate, which is Lopressor, carvedilol, which is Coric, propranolol, which is Enbrel. You notice that all of them ends in LOL, L-O-L, laugh out loud, so it should be easy for everyone to kind of memorize them, or not even memorize them. Once you see the LOL at the end, which is the suffix of a medication, then first thing that comes into your mind that this is a beta blocker. And beta blockers, as we said, it's used for hypertension. and it's used for the treatment of chest pain, usually angina, because usually angina and chest pain is due to constriction or blockage of the coronary arteries, and those arteries are the ones that supply glucose and oxygen to the heart muscles. So if they get blocked or the vessels get constricted, the coronary vessels get constricted, they actually cause a lot of chest pain, because as if the heart is saying, oh, I need more oxygen, I need more glucose, but I can't. So this is how this shortage in glucose and oxygen is being related to that extensive pain, which is, we call it angina. Also, it is used for myocardial infarction. And myocardial infarction, as I think we talked about that before, which is basically changes, morphological and functional changes in the heart muscles due to prolonged ischemia, which is prolonged shortage of blood that is highly oxygenated and has glucose due to a blockage or due to a stroke. And those medications help to maintain the function. They don't improve the function, but maintain the function and prevent further damage by reducing the strain that is on the heart muscles. And it's also used to control or treat arrhythmias. So if there is a high rhythm of the bar of the heart, then those medications will block or prevent those extra rhythms, which are abnormal extra rhythms from at the heart, and therefore trying to make the heart to return the normal rhythm by reducing those kind of extra impulses. Similar medication to it, similar group of medication which is similar to it, is calcium channel blockers. So we have beta blockers, then we have calcium channel blockers, and they also have the same indications of hypertension, treatment of hypertension, angina, and arrhythmias. Their adverse reactions are basically the same thing. They can cause peripheral edema, they can cause drowsiness, they can cause palpitations, pretty similar to the beta blockers, which includes fatigue, low heart rate, which is bradycardia, can cause bronchoconstriction and depression. Those are the main ones for the beta blockers. And then the calcium channel blockers, they can cause palpitations, they can cause actually bradycardia too, similar to the beta blockers. They can cause drowsiness, and they can cause headache. Most common calcium channel blockers are amlodipine, felidipine, nifedipine, diltiazem, and verapamil. So a lot of those medications end in dipine, with the exception of two important medications, which are the diltiazem and verapamil. After that, we can jump into another type of medication, the last in this group, which is basically the cardioglycosides. And the cardioglycosides that only falls in that group is digoxin, which is the brand name is Lanoxin, and it is used in the treatment of congestive heart failure and the treatment of arrhythmias. So what does cardioglycosides do? Cardioglycosides increase the contraction, increase the contractions of the heart, and so they help actually increase the power of the heart pumping without increasing the rate. So the pump becomes can strongly contract and pump more blood efficiently. So that is very important factor in congestive heart failure, which is basically from its name, it's basically the muscle hearts of the heart, the heart muscles are starting to fail. So those cardioglycosides give them extra power for them to pump the right amount of blood for the heart to be an efficient pump as much as it can, as it used to be. It's also used in treatment of arrhythmias, because if you can think about severe arrhythmias like fibrillation, the heart is like atrial fibrillation. The heart is actually fluttering, so it's like looks as if it's shaking, but it's not pumping at all. So if you increase the power of the contractility and give enough time between each contraction and relaxation, and this is what actually cardiac exercise do, they increase the forcibility of the contraction, and that's how they actually increase the number, a little bit, increase the time between the contraction and the relaxation, and by that force, they're actually able to remove, make the heart outside the abnormal rhythm. Last thing, we have also the cholesterol-lowering drugs, and we talked about statins, but there are also other groups of medications in addition to statins that are used to lower cholesterol. Those medications are bile sequestrants, which includes cholestyramine, colcivilam, and colstipol. They're all starts with cholis. So anything that starts with cholis, just what should come up to your mind is that related to cholesterol. Okay. There are fibric acids too, which are the fenofibrate, the gemfibrozil. Those are also should be, once you hear any of the fibrates, then there are also cholesterol lowering drugs. They're basically not really cholesterol, but they are triglyceride lowering drugs, but we treat them both at the same type of groups as anti-hyperlipidemics. Then we talked also about the statins, which is anything that ends in statin, like atorvastatin, lovastatin, pravastatin, rovastatin, simvastatin. Those are a group of medications that lower cholesterol in the blood. And we also have omega-3 fatty acids, which are omega-3 fatty acids that are available over the counter, the prescription ones like Vascepa or Lovaza, and the new antiepileptic drugs that are in the market right now, that are the proprotein convertase subtilin, Kexin type 9, which is the abbreviation for PCSK9 inhibitors, and those there are two right now that you will need to just memorize, which is alirocumab and evolocumab. Some other miscellaneous ones includes ezetimibe, which is Zetia, niacin, which is niaspan, or bempedoic acid, which is Nexletico, and yeah, so that will be the last one, and by this we have finished our cardiovascular related medications, and next time we'll be talking more about the those medications that are used for the digestive system. The last two slides we're going to look about them right now is how we can easily differentiate between some of those cardiovascular drugs. We mentioned like ACE inhibitors for hypertension, metoprolol for hypertension, arrhythmias, atorvastatin, hyperlipidemia, warfarin for clot prevention, furosemide for edema, hypertension. The prils are used for ACE, LOL, as we said, for beta blockers, sartan for the ARBs, like losartan, statins for atorvastatin, dipine for calcium channel blockers. Next time we're going to do a little bit two practice questions in addition to starting our digestive system drugs. Thank you, and hope you all have a great week. and we'll talk to you all this coming Sunday. Thank you.